It's been a trying few weeks for us as we ride the tide of the third COVID-19 wave. Many have suffered great loss, but in the words of Robert Tew, a former professional rugby player, the struggle you are in today is developing the strength you need for tomorrow. Don't give up. So while we can't change the events of yesterday as much as we would like to, today gives us a chance to plan how to win tomorrow, or more specific, how to win the COVID-19 fight. Why not give it all we've got? Thanks for making it Jamaica Magazine. Welcome. I'm Adrian Atkinson. On the show today, we share a few tips to maintain our mental health at this time and look at advancements being made by the Jamaica Council for Persons with Disabilities.
The following is brought to you by the Office of the Prime Minister.
Our children have been out of school for a year and a half. The impact on their education is significant and it will be long-lasting. As a responsible government, we cannot place the education of your children, our children, at risk. There is a ray of hope, and that hope comes in the form of the vaccine.
The proceeding was brought to you by the Office of the Prime Minister.
Good day, I'm Theodore Henry, and this is your JIS News for Thursday, September 9, 2021. Cabinet has approved the development of a national border security policy and strategy for Jamaica. Permanent Secretary in the Ministry of National Security, Courtney Williams, says the policy will lay out how government responds to emerging and existing vulnerabilities in the border security landscape.
The policy will seek to enhance our borders through improving cross-sectoral cooperation among key stakeholders, inclusive of our regional and international partners. It will seek to enhance border intelligence gathering capabilities, data sharing, risk assessment, and the development of responsive security protocols.
Other objectives of the policy are to promote coherence and cohesiveness in border security, as well as to modernize and streamline the legislative framework.
This policy also represents a key priority of the government to disrupt the drugs for guns trade as well as the food for guns trade, and to bolster our own capacity as a country to fight transnational organized crime and these criminal networks. Further, the policy seeks to provide a more cohesive approach to responding to risk, to trade and commerce, the blue economy, and public health emergencies of international concern.
The Permanent Secretary was addressing the Ministry's Border Security Policy and Strategy Stakeholder Retreat at the AC Marriott Hotel on Wednesday. Government has launched an Agriculture Trade Enforcement Advisory Mechanism, a team aimed at removing unjustifiable trade restrictions to make it easier for stakeholders to access international markets. The A-team is expected to strengthen collaboration among key stakeholders such as the Agriculture Ministry, the Bureau of Standards, JMEA, JAMPRO, and the private sector. Among its goals is making it easier for small and medium-sized exporters to report non-tariff barriers and find solutions. Additionally, the A-team will seek to increase market penetration for agriculture and agro-processing products. During the recent virtual launch, Agriculture Minister Floyd Green emphasized that external demand for Jamaican agricultural produce and value-added items continues to increase despite the COVID-19 pandemic. In that context, he says the A-team is critical to the ministry's efforts to prioritize export expansion. Jamaica has been elected to chair the Latin American and Caribbean Forestry Commission, LACFC. The Jamaica's Conservator of Forests and Chief Executive Officer of the Forestry Department, Ainsley Henry, will serve as president of the body for the next 2 years. He was elected unopposed during the opening day of the 32nd session of the LACFC, which is being hosted virtually by Jamaica from September 6 to 10. Mr. Henry says his appointment as president of the commission is a recognition of the leadership role played by Jamaica in regional forestry matters. Meanwhile, Minister of Environment and Climate Change Pernell Charles Jr. is affirming Jamaica's resolute commitment to the sustainable management of forest resources. The minister was opening the 32nd session of the Latin American and Caribbean Forestry Commission, LACFC.
Forests provide essential resources for development of many sectors, from health to education to recreation to our heritage and so much more. We are the country that is defined as the land of wood and water. So it is a source of income as well for many rural communities in Jamaica.
The LACFC is a statutory body of the Food and Agriculture Organization of the United Nations, which meets biennially to advise member countries on their forestry programs. And finally, the National Water Commission, NWC, says it will be donating 10 tablets to one school in each of the 14 parishes to support online learning and teaching. President of the NWC, Mark Barnett, made the disclosure at the agency's recent press briefing. He says 140 devices in total will be distributed to the target schools.
Our regional managers are keen to work closely with those institutions, especially assessing the needs that exist in those communities. This, we believe, is part of demonstrating our fulsome support of the community and how we ensure that community upliftment is achieved through education.
Mr. Barnett adds that the NWC administers more than $13 million in scholarships, educational grants, and sponsorships, including a technology assistance program in which children of its staff can participate. And that's it for JIS News Today. I'm Theodore Henry. Thanks for watching.
Practice good hygiene by washing your hands frequently using soap and water. Here's how you should do it while conserving water. Turn on the tap to wet your hands, then turn off the pipe. Lather your hands and the tap with soap. Turn on the tap and wash your hands, back, front, and in between fingers. Use some of the water to wash off the tap, then turn it off. Dry your hands with disposable hand towels. If you don't have running water, use a hand rub containing 62% or more alcohol. If hand sanitizers are not available, rubbing alcohol, Dettol, white rum, or household bleach will do the trick. And if all else fails, let hand washing and the handling of potable water be a two-person event. Each person will take turns pouring and washing hands with sitting water. Now is a good time to consider installing a tap on your containers to reduce the risk of water contamination. Faucets can be easily attached to drums, buckets, or 5-gallon water bottles. And to ensure that the outside of the containers are clean when recapping, disinfect it with hand rub containing alcohol that's 62% or more. The 5 R's of water conservation are also necessary to practice. Reduce water wastage by investing in water-saving devices. Reuse water at least twice before discarding. Replace leaking pipes, faucets, and other plumbing equipment. Recycle wastewater and use it for gardening, car washing, or cleaning of public spaces. And reclaim water through rainwater harvesting. We all must play our part to ensure there's water to combat the coronavirus and stave off prolonged drought.
Executive Director of the Jamaica Council for Persons with Disabilities, Dr. Christine Hendricks, shares with us about the way forward for the entity and the benefits to its members.
be talking about the transformation taking place at the Jamaica Council for Persons with Disabilities and the various benefits or assistance available to persons who sign up with the entity. For this discussion, we're going to be getting the facts from the Executive Director of the JCPD, that's Dr. Christine Hendricks. Dr. Hendricks, welcome.
Thank you for having me.
All right, let's jump right in to get the facts. Let's begin by telling our viewers what the JCPD does. What's its mandate?
Okay, so the Jamaica Council for Persons with Disabilities is a department of the Ministry of Labour and Social Security, right, and it has responsibility for policy and program implementation for persons with disabilities right across the island.
Okay, so generally the umbrella or the head of policy that directs how persons with disabilities, the access they have. Am I on the right track?
You are on the right track.
Wonderful, wonderful. So a big part of our conversation today is about the transformation that's happening at the JCPD. Right. What's that about?
So the Disabilities Act was passed in the Parliament in 2014. And that process or that act mandates that there is established a Jamaica Council for Persons with Disabilities, right, to ensure the inclusion of persons with disabilities, to ensure that their rights are upheld and to ensure that their dignity are upheld by society.
By all society?
By all of society. Workplace, education, everywhere, life. And so the current Jamaica Council for Persons with Disabilities wouldn't have had the capacity to ensure that the implementation of the Disabilities Act, and so the Disabilities Act establishes this body corporate, which will be an independent government body that can sue and can be sued, yes, as it pertains to persons with disabilities. And so this entity will ensure when the minister states its effective date, that the rights of persons with disabilities are upheld in all areas, in all facets of society.
So if I'm getting this right, no, it is a more autonomous body.
No, it is a department of the Ministry of Labour and Social Security.
It is moving towards?
Moving towards being an autonomous body.
Understood.
Right. So currently we facilitate the educational, social, and economic development of persons with disabilities, right, through our social workers across the island, where we seek to identify and register persons with disabilities first and foremost. Yes. We also do sensitization, public awareness programs to ensure that society understands how to deal with persons with disabilities, know who they are, right, know that they are, part of society. They are human beings just like everyone else, and they should be allowed to participate in society as independently as others. Yes, so.
Yeah. All right. So that sounds like a new day is dawning.
It is. A new day is dawning because not only will we facilitate support for the welfare of persons with disabilities, but we will ensure their rights. And I think that will be a totally new day for persons with disabilities and the society, yes, in general.
So as we move towards this new status of the JCPD, are there any major plans that we can look forward to? Or that is the major plan?
Well, definitely. For the first time, there will also be established a Disabilities Rights Tribunal. So this tribunal will hear and adjudicate matters of discrimination against persons with disabilities, just to ensure that they are allowed. Because if you recognize right now, persons with disabilities have challenges accessing education, accessing employment, accessing even going into a building, sometimes because of the way it has been constructed. Persons have difficulty just with transportation.
Right, right.
And so the Disabilities Act mentions 7 clear areas that persons with disabilities must have their fundamental rights and freedoms in those areas.
If I can interject here, are we talking about the act different from the codes of practice?
Well, the Disabilities Act mandates that the JCPD create codes of practice. And these codes of practice are practical guidelines to society to help persons know exactly how do you do this inclusion stuff. So the code of practice for employment will outline how do you go about employing a person with a disability from the advertisement stage straight to retirement? What are the things that are involved? Similarly for education and training, what is included or what should be included in allowing a child to enter school and to participate and to take their exams with the different assistive devices and supports that they will require straight until they leave.
So it won't, it no longer, I'm hearing two things and I'm very excited about these two things. Number one, there'll be somewhere that if I am a disabled person, I can go here to have a voice.
Indeed.
And number two, the society won't need to guess how employment happens, how access happens. There's a code of practice. For more information, you can visit the JCPD's website, and let me make sure that I get the website URL correct.
jcpdja.com.
So jcpdja.com. That you can visit there to learn more about everything that we've spoken about and get the facts today.
It's the 11th staging of the JIS Heritage Competition. Students, show your national pride by entering the essay, poster and photo competition. Primary school students, enter the essay competition. Triumphant, proud and free. Use this phrase from the song Jamaica Land of Beauty to explain our nation's heritage and achievements. High school students, design a poster that best portrays the phrase triumphant, proud and free. And university students, capture a photo that depicts the phrase triumphant, proud and free. Submit your entries by October 31. Visit jis.gov.jm for competition guidelines. Triumphant, proud and free. The JIS Heritage Competition 2021.
The third wave of COVID-19 and its strain on the health sector and society may be causing some level of anxiety among persons. It's not an easy time, but it is important for us to take care of our mental health. Here are a few things we can do.
It is normal to feel sad, stressed, confused, scared, or overwhelmed during a crisis such as that caused from the COVID-19 pandemic. But there's no need to. For one, we must first inform ourselves about this disease through reliable sources to determine our risk and precautions to take. This can go a far way in calming our fears and ensuring our safety. Keeping in touch with family and friends and talking to people you trust, even as we practice social distancing, can help prevent panicking and keep you in good spirits. If you must stay at home during this period, try to maintain a healthy lifestyle of proper diet, adequate sleep, and regular exercise. Don't use smoking, alcohol, or other drugs to deal with your emotions. If you feel overwhelmed, talk to someone about it, a healthcare provider or counselor that you can call. Ensure that you're fully engaged in something constructive to occupy your time. An arrangement with your employer to work from home where possible is good in helping to keep up normal daily routines. Limit the time you and your family spend watching, listening, or in conversations about COVID-19 that you perceive as scary or upsetting to avoid being overwhelmed. Make sure you are in the know generally, but try to engage more in other things or change the topic of your conversations to things you enjoy talking about. Draw on the skills that have helped you manage previous adversities. It's important to try to maintain some sort of daily agenda so that the days are not wasted and you'll feel more accomplished. Focus on activities that make you feel happy, like reading a book, watching your favorite show, playing video games with your family, or telling stories. Do some gardening or chores around the home too. Children too need to be provided with the information to help them understand the risks without becoming scared and confused. Use age-appropriate language to teach them about hand washing, cough and sneezing etiquette, and social distancing. It's also important to reassure them about what could happen if they start feeling sick and may have to go to the hospital so doctors can help them feel better. In the meantime, ensure their learning continues and give them extra time and attention. Listen, speak kindly, comfort them, and of course, make time to play. When it comes to easing fear and anxiety around COVID-19, just consider that once we do what's necessary to protect ourselves and prevent spread, we should be well. If we do get sick, rest assured our doctors are trained to manage the illness and help us recover. And yes, while we maintain proper cough etiquette, cover our noses when we sneeze, and practice social distancing, we must treat each other with care and respect. Don't be startled by every cough or sneeze. Remember, not everyone who does has the virus. Take care of yourself, support others, don't panic.
The following is brought to you by the Office of the Prime Minister.
We see parents who believe children have no rights and must be lashed in order to be brought under control. And we see family members who believe that the only way to resolve disputes over ownership and property is by fighting, oftentimes to the death. And we see intimate partners viewing each other as property with rights to control, even by force. And we see it in the gang and don culture employing violence to control and subjugate entire communities. Let us all commit to protecting our freedom from violence.
The proceeding was brought to you by the Office of the Prime Minister.
Up next, home delivery service for medication to the elderly by the National Health Fund.
Senior citizens in the cohort 60 years and older represent the fastest growing demographic segment of the society as more people are living longer. This changing dynamic has prompted the government to ensure improvements in the level of responsiveness to new expectations and needs of our seniors. The need for quality healthcare is top of the list. One aspect of quality healthcare service is the prompt access to affordable medication. So the Ministry of Health and Wellness, through the National Health Fund (NHF), has been leading the government's charge in providing critical supplies of medication at subsidized costs to persons in need. That includes seniors. The NHF has been improving its service by employing ingenious means of delivering medication and reducing waiting times and overcrowding at prescription outlets.
We are using a number of services in order to make it easier for our customers. We have the Prescript mobile app, we have a drop-off and pick-up service, we have scheduled refill for persons who come to the pharmacy frequently with the same medication, and we have a number of other initiatives in which we contact clients to work out easy ways for them to receive their medication.
A home delivery service for drug-served patients 65 years and older is the NHF's latest addition to its offerings. This emerged as a response to the coronavirus pandemic.
As most people know, the NHF is a customer-centric organization, and with COVID-19 we actually looked at different ways of better serving our customers. Medication delivery is an idea that we have had under active discussion for a number of years, and we found that this was an opportune time to implement this service.
This new service is available to drug-served patients on the NHF's scheduled refill program who have monthly appointments to pick up their medication at a drug-served pharmacy.
So for these patients, we give them 2 months supply of medications, basically. And the feedback is just excellent. It's really great. But when you look at how grateful they are, because some of them they can't walk, some of them they're disabled in terms of hearing and so on. So when you can come to them to actually give them their medications, it's really heart-touching, basically. So and they're very grateful. They say it all the time, and they are loving the service as it is now.
This was started in St. Thomas, and we've expanded into Kingston and St. Andrew, as well as in St. Catherine. And other parishes have now started, St. James and other parishes. And the intent is to have this program island-wide.
The NHF's home delivery service is set to benefit approximately 30,000 beneficiaries over 65 years of age, as well as other vulnerable groups that the fund believes can benefit from medication delivery.
We just received a call, asked if we would want it to be delivered, and we readily accepted it. The wait can be very long. I know they try to cut back sometimes by using the schedule thing, but even then you have to go, and sometimes they wait up to an hour. So this is just ideal.
Patients may want to check out the NHF's online avenues such as web chat to indicate their need for delivery service. Persons can text their name and their drugstore pharmacy to 876-219-9937 or 876-219-9929. They can also call the NHF at 876-906-1106 from 8 a.m. to 4 p.m. weekdays.
I take the opportunity to commend our pharmacists, our pharmacy technicians, and all the team who facilitated this.
This is a good service, man. Let me say you must stay at home. And this service that you will come and present, a wonderful service.
We are loving the service. We really appreciate it, and we wish it would continue.
Customers need not worry about having a National Health Fund NHF card or a Jamaica Drug for the Elderly JADEP card. The service will still be offered.
But at this time, when we come and realize that, oh, probably you don't have a card, what we can do is give you the steps as to how to get the cards. And in order to access the cards, it's a same-day printing at any of our drugstore locations that are named for that service.
The NHF, reaching out, helping to make Jamaica the place of choice to live in good health.
Technique that will be explained today is the technique of boiling. What we advise is for you to obtain clean water, water that you can see through. Then you would place it into a pot, you'd cover the pot and allow for it to boil. Allow for rolling boil for about 5 minutes. Then it would look something like this. Then after you would have achieved the 5 minutes of rolling boil, then you'd allow for it to cool. Then you would place it inside of another container.
Use an airtight container to store your water. If the water is not used within a few weeks, be sure to carry out additional treatment of the water. That may include boiling the water once more.
This is where our journey ends, but only for today. Do join us again tomorrow and we'll bring you another informative program. In the meantime, stay connected via our website, jis.gov.jm. And while you're online, send your feedback to Jamaica Magazine at jis.gov.jm or via tweet at JIS News. You may also find us on all the major social media platforms and through our mobile app that's Android and iOS compatible. On behalf of the entire production team, I'm Adrian Atkinson. Do take care.
This has been a production of the Jamaica Information Service, the voice of Jamaica.